Thank you to Viva Learning and GC America for the educational grant for this program to present Restoration Complete Now What? How to protect and recharge your restoration. So thank you to all of you for joining me at sunset. And this is actually a sunset picture taken here at Mini Glacier Lodge, which is up in Glacier Park, which is about 3 hours from my home here in Missoula. This is my disclosure slide. I do consult for several companies, mainly on trying development and research of products that would be safe for natural teeth and restorations and implants. So my passion is to do research and development. And so that's primarily been my focus for the last 5 years, and I've really enjoyed it and continue to enjoy it all the time. So thank you again for joining me tonight. And we're just going to go over what the course will cover. I'm going to outline the guidelines, for safe and effective maintenance for both tooth-borne and implant-borne restorations, not disease patients, but protocols for patients for normal maintenance and recare. And then give you some recommendations for in-office and home care products that are going to protect and recharge restorations. And then some new protection equipment, especially for you and your patients. So tonight's program is based on prevention and protection for both yourself, for prevention of things, preventing patients for their teeth, and restoration protection as well. So let's start with the guidelines. And the guidelines for safe and effective maintenance for implant-borne and tooth-borne restoration patients. The American College of Prosthodontics brought together 10 of us, 8 dentists and 2 hygienists, Diane Delbert and myself. We put together a set of guidelines that I think are really important for you to download and to understand, and especially with tonight's lecture being based on restoration protection and prevention of that longer life for the restoration and for implants. Download the clinical practice guidelines on my website. It looks kind of technical here when you look at it, but once you get into it, there are charts, and it's based on which type of restoration is in the mouth. So you can look at your patient, you look at the restorations that they have present in their mouth, and you're going to be able to look at this chart, and it's going to go over what is the latest in maintenance for this type of patient with this type of restoration. For example, if they have a 3-unit bridge, what is the best maintenance for a 3-unit bridge patient right now? What are the best home care recommendations for that patient right now? And what is the best recare for that patient? All of these recommendations were based on biofilm science, with biofilm at the forefront of the information that we went by. And so it is biofilm focused care is what I call it. So it's kind of a paradigm shift, and it has changed what we do in our regular prophylaxis appointments. So I'm just going to highlight a couple of the things for tooth-borne and implant restorations. One of the main things that we did recognize based on the science, based on the research, is that we do need to recommend that especially hygienists have a powered instrument with glycine air polishing system. Doesn't matter which one, but that's going to be a very important tool for them moving forward. That is basically going to be their biofilm elimination tool. Then we notice the signs of occlusion. And when you are looking at the research, especially now that we're putting in more implants in the patient's mouth, we really have to be on our toes with occlusion. So any patient with restorations or implants, we're going to make sure to have blue indicating paper on your tray for each and every implant and natural teeth maintenance appointment. So if you look at this list, this is a list of oral hygiene aids. I kind of call a power tool list, you're going to notice that it's based on disruption of biofilm. So it highlights things like an electric toothbrush and a water flosser. And we're going to get into more specifics on that. And then for implants specifically, it's no longer a question as to what type of instrument should we debride implants with. The studies are clear, the research is clear, that it's titanium implant scalers or titanium, only piezo tips at this time, but piezo ultrasonics that are going to be safe to debride implants with. And then recall. We're all familiar with the 6-month recall. That's something that we've heard many, many times. But when you're talking about biofilm focus science research, it means at every patient of record comes in every 6 months. That might not be something that you've had done in the past. You'd have patients that have what you think of as really good oral home care, and they come in once a year for their maintenance visits or once every 2 years. It isn't based on that any longer. Now that it's based on the biofilm science, we want to professionally remove the biofilm on these patients at least every 6 months for their overall health. So we're not basing our recare on how well they do their home care at home, somewhat, but not always on that. It's based more on their restorations, how possibly biofilm could be trapped under a 3-unit bridge or around an implant. So it's based more on that biofilm science. So just to kind of highlight some of these, the powder streaming air treatment is a professional biofilm removal tool. Here's 2 examples. You've got your airflow master system by EMS, which is kind of the Cadillac of this. It flushes itself and it's easier maintenance for working with patients. Then you have your handheld model, and several companies are now making the handheld model. This is the Air and Go Easy by Acteon. They are only using glycine powder in most of these powder streaming devices. EMS has a second powder, erythritol. Both have really good research now based on the European workshop that's been done in their perio department. They base this as one of their gingivitis and mucositis treatment main tools. So it should be kind of on your I need it now list, the list, your biofilm removal tool. I know many of us are hygienists that started without having an ultrasonic scaler, and we wondered at the time, do we really need this ultrasonic scaler? You know, do we really need that? We can just use instruments. But now, would we give up our ultrasonic scalers? Probably not. We really look to them as an important tool and an important part of our prophylaxis appointment. Your powder streaming device is going to be your professional biofilm removal tool. We really don't have anything else to use for that. We can substitute it somewhat, but this is something you should put on your I need it now list. Then just kind of highlighting, the occlusion part of this, we do need to look at the occlusion, and especially now during the stressful time that we're in, we're finding more people under stress than ever before, people that maybe never ground their teeth before, but now during this virus time, they are. We need to make more of a focus on occlusion. So have a blue indicating paper out at each and every one of your maintenance appointment exams for natural teeth, restoration patients, and implants. And then instruments. Here's some examples of instruments that are related to implants in particular. So we know that we don't have to worry about knowing which type they need to be. Titanium. All of your titanium scalers are going to be safe to use around your implant restorations, but it is ideal if you can pick a titanium set that has a Rockwell hardness between 28 and 30. Those sets are also going to be able to clean and prosthesis safely without scratching. And soft titanium, when we did the SIM testing that we did on ceramic implants, turned out to be the better option for around ceramic implants. So whether it's a titanium implant or a ceramic implant, you're going to want to use titanium scalers, preferably with the Rockwell hardness of 28 to 30. Two examples here from Brasseler, and this is their new set. They should be blue. And then the PDT set, the Wingrove implant set that I designed with my late husband, is the other option. Then for ultrasonics, we only have two options because there were only two that actually tested safe to use around titanium and ceramic implants. And that was the Implant Protect tips from the Acteon piezo, with the Acteon piezo, and the Peak tips with the Mectron piezo. And with the Peak tips, we recommend that they only be used once, one-time use only. So what about patients, with what should they be advised for home care? And we looked at this list, and if you look at this list again, you notice that it's highlighting the electric toothbrush rather than a manual toothbrush, mainly because we want to try to find different tools that are going to really disrupt that biofilm. And then you've got your interdental cleaners. Sometimes here in the US, we don't use interdental cleaners as much as they do internationally, but that's changed now. And I think more and more of us are realizing that we need to recommend interdental cleaners to our patients. And then water flossers. Waterpik has done most of the research in the water flosser area. They have really good research now out on biofilm removal, and we're going to talk about that more tonight as well. So my main topic that I really want to get into in this program is to talk about bioactive restorations. What exactly bioactive means. You want to get into the tooth structure and tissues to buffer them, form a protective seal on the outside of the structure. So when the acid biofilm, that's like 4.5 pH or lower, threatens the tooth structure, the restoration or the sealant will take the hit. I think a lot of times this is misunderstood how this actually works. But if we are working with a true bioactive restoration, they will often sacrifice themselves. They'll dissolve. They may need to be replaced, but they did their job because they protected that tooth structure. They also release fluoride right at the tooth restoration interface to protect against caries forming right at that interface area. They do remineralization and they reduce sensitivity around those fillings or sealant materials. So we're going to also, they work to help the patient's pH levels to remain in balance. So you want the balance to be about 6.0 to 7 is ideal. So we're going to talk a little bit more about that, but start to think about ways that you can check your patient's pH levels as well, and try to get into the mindset that we'd like to try to have our patients in a neutral pH in their mouth with different products for home care, with bioactive restorations that are also going to help us in that regard as well. So here's some examples of different biofilm restorations, bioactive restorations. You've got your Equiforte family, whole family of glass ionomers to pick from that have rechargeable capacity. That means that when they are placed by the dentist, the hygienist can then recharge them at the maintenance visit. So we're going to talk about how do we do that? How do we recharge these restorations at the hygiene appointment. So this is the link, the synergy link between the dentist and the hygienist, just for overall care of the patient. Another example is the Predictive Family by Parkell, which has different core products and bulk products to use as well. So those are a couple of really good examples for you. So the doctor is going to place that restoration, and the hygienist is going to recharge it and monitor it at the maintenance visits, and then recommend home care products that are going to be able to recharge those restorations on a daily basis. So let's just talk about sealants, because sealants, a lot of us think of sealants as only for children, for sealing molars. Maybe you do it once on a child when they first develop their molars or their premolars, and you don't continue it. Bioactive sealants, as they are set up as surface protectants and sealants, are now something that we should consider using on all age patients. We should consider them for our high carry risk patients from the beginning. And we should monitor them. We should recharge them at each maintenance appointment. And if we see that they are missing or are been sacrificed because the acid has gotten to them, then they need to be replaced. So we could virtually be doing sealants on our patients from the time that they are very young and continue that through adulthood. And then even into their older age, where now they are more susceptible to decay again, so they continue that for the life of the patient. So sealants are taking on a whole new meaning now with biofilm in the mouth. We want to try to protect our teeth as much as possible, and we can use that by doing sealants. Also, desensitizing treatments. There's a bioactive desensitizing treatment by Parkell that you might want to look at as well. So how do we recharge these patients? How do we recharge these restorations? And what is our goal as the clinician? And what is our goal for the patient? For the clinician, we want to monitor the restorations each and every time that we see our patients. And this holds true for any composite restoration or monitoring amalgam restorations in the mouth as well. The clinician should get in the habit of checking the edges on these restorations. Hygienists, we have 45 minutes to an hour with patients where we get a really good opportunity to check each and every tooth in the mouth very carefully, and the tissue for inflammation as well. And we're going to check it. I often use the Montana Explorer because it is so thin. It's like a pigtail Explorer, except even thinner, with a very sharp tip on the end. And I found that I could really look at these composite fillings or bioactive restorations around the edges of them to see if they are needing to be replaced or recharged. So we can place fluoride varnish, and it's good to have a flowable varnish that's going to flow in and around these restorations. We're going to place the fluoride varnish on the facial and the lingual, but also on the occlusal surface. So we want to go over all the occlusal surfaces as well as interproximal on our patients. So take your time with that varnish and really make sure that you're working at that. Now, the GC varnish has a special component called recaldant. And I'm just going to talk about recaldant for a minute because I think it's an impressive, one of those wow things that we really should know about. GC has, had bioactive glass ionomers from the beginning. They've built the research and the science around these, and now bioactive restorations are really coming into the forefront with this biofilm focused care. And we want to know a little bit more about recaldant. The peptide combines and stabilizes the fluoride in the product with recaldant in it. It makes calcium and phosphate and fluoride all bioavailable to protect and repair the natural tooth, to remineralize, and to recharge around bioactive restorations and sealants. So we would at each visit check the restoration, check the sealants to see if they need to be replaced, and seal them with a fluoride varnish. What about the patient? What can the patient do to protect their restorations on a daily basis? They can use products like the MI Paste 1. That's an 1100 parts per million fluoride that is neutral pH, and it also contains Recaldent as well, so that works with the fluoride together is the real key. So we want to look for products like that. So what do we do about the in-office protocols now? You know, what do we use and what should we not use when you're talking about protecting teeth and recharging restorations? We have a specific in-office procedures and things to protect that, starting with protecting, especially now is a very important thing, but it has always been in place, and that was the pre-rinse to protect you from any aerosol spray or aerosol time during your appointment, and protect the patient. Then place the Optigate. And your Optigate is a latex-free retraction tool that's going to work with helping the patient to cover their nose when they recline in the chair, and also for visibility for you as well. We're going to identify and remove the plaque and biofilm. We're going to try to use products that will show us that you can use disclosing solution. You can also use a product called Tri-Plaque ID Gel, which we're going to talk about tonight, that actually identifies the biofilm. Then we're going to use products to buffer the patient's pH. We would like the patient's pH to be in neutral during the time that they are in the chair. And, you know, this part is kind of confusing to some people as to why we have to worry about that, but we're going to talk about that a little bit more, how we can do that, and we protect and buffer the patient's pH for each and every patient that we see. And then debride any calculus present, lavage, and we're going to use silica polish, no pumice, around any restoration patients or implants. Then we're going to apply the fluoride or an antimicrobial varnish or your desensitizing treatment or sealant would follow after that. Then we're going to set a recare appointment for at least every 6 months. So that means 2 months, 3 months, 4 months, or 6 months, based on the type of restoration that they have in their mouth. For instance, implants are primarily a 3 to 4 month recare because biofilm is such a risk factor for implants. So it's based on risk factor and type of restoration in the mouth. And this is going to help for their oral and for their overall systemic health that they're seeing at least every 6 months. So let's start with the pre-rinse and the retraction. You only need a 30-second pre-rinse. A couple examples of that are the Closest, which is chlorine dioxide, or the clinical formula by Crest Oral-B, which has hydrogen peroxide in it as well. There are other products, general hydrogen peroxide that some people are using now as well, but just as long as you are using a pre-rinse. And for some people, they don't realize that you should use a pre-rinse on a patient. And then if you haven't done a procedure where you need to worry about it, you can have them rinse again before they leave the office. But for a hygiene visit, we're going to seal their teeth with a fluoride varnish, and we're going to ask them to not eat or drink for an hour. So we would not do a post-rinse on our hygiene visits. But for general work or general procedures, you could do a pre and a post rinse before the patient left the office. So Optigates, and Optigates are latex free. They protect the patient. They allow us to see everything. You do need to practice a little bit if you've never put on an Optigate before, but once you get the hang of it, it is very quick and efficient for you to do for the patient. And it visually lets you do a lot more drying of the teeth, a lot more sealing of the teeth with varnishes, and it's going to be your new assistant for you hygienists that don't have an assistant. So once we've placed the Optigate, we're going to use a disclosing solution. I like to try to the Tri-Plaque ID gel because it does identify the biofilm as well for the patient. You have your new plaque, which is your red or pink plaque. Now, plaque will happen, or biofilm will happen right as soon as you leave your home, and it's been minutes, they'll start developing. So we're not as concerned about the red and pink new plaque. The mature plaque that is dark blue or purple, now that's the one that you could show a patient with a handheld mirror and say, you know, these are the areas that you are missing when you're brushing. But what we're really concerned about and we really want to identify is your acid producing biofilm. And to my knowledge, this is the only disclosing solution that shows this, and it shows a 4.5 or pH or lower. If you see here on the light blue areas, you're going to want to identify them and record those for the doctor when they come in to do the exam. We know that 4.5 or lower is a sign of caries, so we're going to write down the teeth that we see any light blue areas on for the doctor to check for possible areas of decay. If you see the light blue on an inflamed gingival area or recession area that's bleeding for inflammation, that could be possibly need a tissue graft, or it's gingivitis or mucositis starting. So we want to identify those things as well. Now you have a roadmap, if you picture this in your mind, that you can remove the biofilm with. So that's our next step, to remove the biofilm. And what is the best way to remove the biofilm? Using a subgingival air polisher is ideal. This is your biofilm professional tool. We're going to do it at the beginning of the appointment. If you've not done this before, you pick 4 sites on the tooth. It's 5 seconds per site. I like to start on the distal, 5 seconds, go to the facial, go to the mesial, and continue for the whole arch. Then hit the linguals on all of those teeth for that whole arch. Then start on the upper and do the same thing. You can get very fast and effective with this, and you want to count 5 seconds in each place. You notice the tip is not completely submerged, where you still see a little bit of the circle area on that, or when you're using an EMS tip as well. That is not a concern. You're going to see it's kind of a powdery, flowy water that flows down in and around the tooth structure. So you just want to go to the level that you need to. What if you don't have a subgingival air polisher? We want to give you something to use for this step. Our best indications are that you should polish first. Maybe you've always polished your restorations or polished the teeth at the end of the appointment. We're just going to reverse the order. So we're not going to give you something extra to do. You don't do it both times. But polish with a silica paste with xylitol that's going to attract the bacteria. So you're going to take your time, and you're really going to focus on going in between the teeth with the rubber cup. You're going to do a real exacting polish on all of the tooth surfaces. Then we're going to buffer the patient's pH level. And how do we do this? And this is just not just for perio or patients with caries. We're going to give the patient, I feel that this is the fastest and the easiest way to do this. There might be other ways to do that as well. But I find if you can give the patient MI paste, and these would be patients that do not have a strict milk allergy, you'd want to check that ahead of time, but it works within 3 minutes to balance the pH neutralize the pH and elevate the pH levels. It actually elevates the patient's level for 48 hours for regular MI paste and 96 hours, which is a huge wow. You know, if our goal in biofilm focused care is to maintain a neutral pH in the body for the patient, the mouth is a really good place to start, because what happens in the mouth, it's a window to the rest of the body. So if we can get the oral cavity to stay in a neutral pH for the whole day for patients, we're going to recommend that they take a tube of this MI paste home and continue to do that on a daily basis. And the 48 hours and the 96 hours, if you read the research and everything well, will be affected with what you eat and drink. So as a recommendation to patients, you're going to want them to try to use this at least once daily. And right before they go to bed is an ideal time, because they don't spit it out, they just leave it in, and it's going to balance their pH throughout the night. Next, we're going to debride and get rid of any calculus that we find present. And we're going to do that with the proper scalers and the proper ultrasonic tips. So we lavage before and after debridement. We use stainless steel instruments for natural teeth. 3 to 5 instrument is now recommended for ergonomic reasons. And titanium scalers recommended for any implants present. I've got an example of a Mectron piezo here. For natural teeth, you're going to use any of the stainless steel tips. And for implants, you would use a one-time use PEEK tip. So remember, you're going to lavage before and after. So if you don't have an ultrasonic with implant safe tips, you would just lavage and not touch the teeth for debridement with that. So what's next? We're going to talk about prophy paste. Why silica versus pumice paste? And this is a really big one for all the new dental materials on the market, and it's something that it has really fascinated me, because there's been really good research out for some time back in the 80s that we should really not be using medium or coarse pumice paste, only fine pumice paste. But we continue to use medium and coarse pumice paste to remove stain when we can do other things to remove stain around the teeth as well. I'd like you to just think about considering taking the I call the silica pumice challenge. When I have participants with me, we often do this, and they can really see the difference. You want to take some kind of a dish, just some kind of a clear dish. Put in the prophy paste that you're using now, and wet your brush and mix it around on the plexiglass. Rinse it off, towel it off, and leave it. Then do the other half of the glass dish with silica paste and do the same thing. Then carefully wipe out the dish and look at it, and hold the dish up to the light to view the results. You're going to be really shocked at how scratched that glass tray is, how much scratching just even medium pumice paste makes around these new dental materials that are on the market: full ceramic crowns, bioactive restorations, composite restorations, and particularly now our full arch cases that have implants as well. We do not want to use pumice paste on any full arch implant prosthesis. So we make sure that you are using and starting to develop using silica paste for your pumice paste to protect all of your restorations. Then you're going to apply fluoride varnish. Now here's a couple examples of fluoride varnishes. Why is it so important that we need to have a neutral pH fluoride varnish only when implants are placed in the oral cavity? That is because there can be a chemical effect on stannous or sodium fluoride around on titanium alloy if the pH is too high or too low. It must be neutral. Now this is just fluoride composition of 3.0 stannous fluoride or sodium fluoride or above. So if somebody uses a product in the drugstore, that is not a problem. But for us, actively painting on a fluoride or using any kind of high fluoride rinse with even one implant in the mouth, we have to make sure that it is a neutral pH. So get in the habit of having a neutral pH varnish be your varnish that you use in your office. And with these are two really good examples to start with. Then you can also use an antimicrobial varnish. This is a good consideration around implants. Fluoride is not going to do anything for around an implant. So if you have implants, you can even just, if one implant in the mouth, you can use an antimicrobial varnish on that implant area where you want that biofilm protection for up to 3 months, and use a fluoride varnish on the other teeth. But just make sure that it is a neutral pH fluoride. Cervatec Plus is the only antimicrobial varnish on the market today. It is slow time release. It is a chlorhexidine, but it is chlorhexidine diacetate, which is very, very different than gluconate. And it is clear, non-staining. So you can use it around any of your cosmetic cases, restorations, around implants. And the really, really wow thing of this varnish is that it can prevent biofilm formation for up to 3 months. That's really huge, because if you start to look at your ACP guidelines on implant patients, they are primarily a 3-month recall patient. So if you can put biofilm protection around those implants, and then the patient comes to see you again in 3 months, how wonderful is that? That's just a really good peace of mind for both the patient and for yourself. So whenever you're using a fluoride varnish or a chlorhexidine varnish at the end of the appointment, make sure it is the last thing that you do on the patient, because you want them to not eat or drink for 1 hour. So what about the home care products? What do we use to protect and recharge natural teeth and restorations for our patients? We have really good prophylaxis home care recommendations. You will brush twice daily with an electric toothbrush, manual or interdental brush, and a neutral pH toothpaste. Then you're going to floss or use a water flosser. You don't need to use both, but you want to use one. And let's say the patient really, really likes their manual toothbrush and they do a really good job with it, then recommend a water flosser. But try to recommend either an electric toothbrush or a water flosser that can give you 80% biofilm reduction in the patient's mouth at least every 8 to 12 hours. Then rinse twice daily with a non-alcohol antimicrobial rinse. You notice we really don't see a lot of alcohol mouth rinses on the market today. That is because they have found that that only killed single bacteria. It did not do anything for biofilm. So with a biofilm science focus and medical model that we should be going by now, we want to be using a non-alcohol antimicrobial mouth rinse. And we want to recommend that every patient use an antimicrobial mouth rinse, or they can add it to their water irrigator or water flosser in 1 parts to 9 parts water. For your restoration or your implant patients, now these patients, you want to be sure that you're using a rubber tip stimulator around those restorations or implants, or you can have an electric toothbrush that has a massage setting or gum care setting on it. Switch it to that and actually focus on doing a smiley face on the lower around the gum line, form little smiley face around each tooth, and on the upper, do a frown and do that on the linguals as well. But so you can use either a rubber tip stimulator or an electric toothbrusher on the massage setting. So let's just talk about the electric toothbrush a little bit more, because with biofilm focused care, it has really come to the forefront of something that we should recommend. It's going to automatically remove that 80% biofilm that we really want to be removed on natural teeth or around implants, because that is a major risk factor for oral and overall systemic health. If you have a patient with a medical history and they're diabetic or have heart disease or have other issues listed under risk factors on their medical history, they really may need to make sure they're getting rid of all the biofilm effectively in their oral cavity at least twice daily. And now we have electric toothbrushes that both disrupt the biofilm and stimulate the tissues. And they also navigate to show you on an app on your phone as to whether you've left any biofilm behind. That's just not like a gimmick or anything. That's actually telling a patient that has heart disease or other areas, biofilm that they left in their mouth, that now they want to go back and get that before they go to bed at night. So it's really important to look at the patient's medical histories. If they have any risk factors there, they are really a good candidate for an electric toothbrush. We have new electric toothbrushes now. The iO has micro vibration technology. I'm going to kind of introduce you to that tonight. If you're not familiar with it, it is different than sonic or general electric toothbrushes. In the past, we've only been able to see a 35% reduction in bleeding sites, over different toothbrushes. Now we can see that this brush is actually 59% greater reduction in bleeding sites than even a regular sonic toothbrush. It's very quiet, it's very smooth. You hold it in the hand. People that typically have arthritis or other issues where they can't hold that vibration in their hand can hold this new micro vibration technology. So you're going to brush with an electric toothbrush, whichever one that you find, for 2 minutes, and then switch to a massage setting for 1 minute and trace around the gum tissue area or around the restorations. So how do we get the patients to recharge their restorations? Using a neutral pH. Toothpaste is an MI paste with 1,100 parts per million twice daily is a really good choice. We're always talking about neutral pH toothpaste, but how do we know which toothpastes are neutral? Most of the 5,000 parts per million toothpaste were not a neutral pH. But the good news is that the research is pretty clear now that 1,100 parts per million sodium fluoride is comparable to the effectiveness of 5,000 parts per million. So MI paste is also going to give you that fluoride that you really want, that you've been prescribing the 5,000 parts per million to your ortho patients and your caries patients and your patients with a lot of restorations. And now you can recommend MI paste 1 for those patients. And that is also a prescription that you need to give out MI paste in your office. They can supplement during the day for their bioactive restorations with GC MI paste plus. And you can give them that. When you apply MI paste, you just add a pea size on your finger. And show the patients how to do this when you're doing it in your chair to buffer their oral cavity. So put it on for them with a mirror or have them do it for you so you can see and go over all of the different surfaces, the occlusal surface and the lingual with your finger, or they can rub it around with their tongue as well on all of the tooth surfaces. So it should work within 3 minutes for them. And they don't need to spit it out. It just dissipates. So what about flossing? And flossing, the biggest thing with flossing for natural teeth restoration or implant patients is just that you can recommend flossing, but it is ideal now to recommend a water flosser. A water flosser is going to give them that 80% disruption of biofilm more than regular floss. But if they're really going to floss and they want to floss their implant in specific, there are specific things they should know. And when you're flossing an implant, you want to start on the mesial, insert the floss on the distal, crisscross it in front, and then you're going to move it back and forth in a shoe shine motion. What that does is it takes it off of the restoration, moves the floss down to where the abutment meets, where the implant interface is, and you're going to move it back and forth a few times. Now, this is the part where you need to make sure that the patient is doing this, if they're doing this at home, is that they don't pull it through, that they remove it on the mesial and they remove it on the distal. Don't pull it through. Okay. There we go. Then what about water flossing? You're going to do that twice daily. You're going to do it at a 90-degree horizontal angle where you see how the water flosser hits the tooth and then flows up and down on the tooth surface. There is no need to point it down in. This is an example of the plaque seeker tip, which has bristles on the end. One of my favorite tips because it actually scrubs and water flosses at the same time. 81% more effective than using floss. Then they have a new implant denture tip I wanted to share with you today. This is for the full arch cases. It's going to be inserted on the lingual, and it will work for the whole area underneath these full arches. So you can see how that works. Access is quite difficult, and if they can put this on the lingual surface and use it, that is one of the key tools for a full arch prosthesis patient. Then the rubber tip stimulator or electric toothbrush. You're going to want to use that once daily. And you're going to, I have a nice video on my website, Wingrove Dynamics, that shows you how to use a rubber tip stimulator by pressing it flat against the teeth or against the implant. You're not poking it with the tip. You're blanching the tissue and rolling it and massaging it. You should see the tissue kind of blanch if you're massaging it, right? And for an electric toothbrush, remember, you just move that to the massage setting and do that once daily. Then your antimicrobial rinse, what are some of the components that you want in the rinse? You're going to want to kill the bacteria. You're going to want to break up the biofilm. You're going to want to eliminate the VSCs, which are the volatile sulfur compounds, and you want it to last for 8 to 12 hours. That's why we've moved away from the alcohol and the chlorhexidine gluconate and the antibiotics, because they don't break up biofilm or eliminate the VSCs. That was kind of our missing link. So really good examples of mouth rinses to consider are any of your chloride type mouth rinses, like your CPC mouth rinse or your chlorine dioxide products. So for home care, we really need to recommend tools like your electric toothbrush or your water flosser. You don't necessarily need to use both, but you need to use one or the other. You want to eliminate the volatile sulfur compounds. Those are gases that we usually just associated with bad breath. However, the new research, we now know that the VSCs are toxic to the tissue, and why we still have inflammation around some patients that we thought, wow, we really gave them the right treatment, we gave them the right tools, and they're still bleeding. Well, they probably need a mouth rinse or some kind of effective way to eliminate that volatile sulfur compounds at least every 8 to 12 hours. And then we need to stimulate the tissue to promote keratinized tissue around the restorations or the implants to prevent any loss of tissue or bone. And then use neutral pH products, okay, to kill the bacteria, eliminate the VCs, and inhibit that plaque and regrowth for 8 to 12 hours. So brush, use a water flosser or floss, you don't need to use both, and use an antimicrobial rinse. So now I just like to pivot into a little innovative products to protect you and your patient, especially during this time. I've written a few blogs on this on my website. You can get that on Windgrove Dynamics. But I just want to share a couple of things on pivoting into the new normal with you. I researched this different products and innovations to protect you over a year ago, long before all the COVID started. And I just wanted to, re-emphasize that these things that we are changing and we are using during this time are things that we should keep in effect. We should keep doing these same things for our aerosol protection. And Closest has just completed a study that I wanted to share with you for their oral rinse and their spray. This is pretty exciting news. They know that now they can reduce the risk of COVID-19 infections transmission in 30 seconds. You want to try to protect yourself. You should be doing this twice daily, every day. And then at the office, maybe do it 3 times. Do it in the morning, do it after you eat lunch, and then do it before you go home. So this is something that you can incorporate as a pre-rinse and have at your office, or you can use the spray. And the spray, the interesting thing, they just completed the study on the spray just about a week ago, and that was 99% more effective. So it's just tremendously, but they do have the new study out and available for you on their website. It is 98.4% kill of virus germs within 30 seconds. So that is pretty easy way for you to protect yourself and to recommend to protect your patients on a daily basis. I did an article for Dental Economics and RDH Magazine in September, and I just want to share a couple of protection things for long-term health for yourself as well as your patients. So you want to, the average dental office completes about 1,000 light cured restorations and multiple cure annually, and chronic exposure to blue light has been linked to color distortion, eye strain, headaches, retinal aging, age-related macular degeneration. That was what really drew me to this and what I was researching. And this is before the COVID time started. And we're just trying to look at how can we protect ourselves now that we have everything that lights up. We have a light on our loops. We have an overhead light. We have a light on our handpiece. We have curing lights. We have laser lights. We have a lot of lights coming at us in all different directions. And we need to also recommend specifically safety glasses for our patients as well. One of the ways that we can protect ourselves is to create what I call a non-reflective environment. And you notice I have black gloves and black masks on the picture in front of us. The black gloves are actually shown to reflect your loop light and other lights from reflecting back in your eyes more. So as simple as just changing to using black gloves instead of other colored gloves in your practice is going to help the longevity of eye health for yourself. A mirror, like this mirror that you see here. This is made by Hufredi. It's a HD light that is the actual mirror component as 80% less glare on your eyes. However, it is really good for visual. So it's a real good visualization tool, but it doesn't reflect the light back into your eyes as much. So changing your mirrors, changing your gloves to use a different way. And then also consider your patients as well. So your patients should have safety glasses on, and particularly orange glasses when you're doing any curing. I know you have little shields and things like that, but you want to protect the patient's eyes as much as your own eyes, and everyone should be wearing the correct eyewear. Also, instruments. If you notice on this mirror and on other resin-handled instruments, they are non-reflective. So use resin instruments or non-reflective instruments, not your shiny stainless steel instruments. So start to try to evaluate your personal protection equipment. Make sure that you're protecting yourself and your patients for long-term health. I'd also like to share this new product because it is such a product in need right now. It's called Easy Flow Fresh Air Anywhere. And you can see that on easyflowusa.com. It is a very reasonable way for you to get more fresh air volume behind your mask. So this is just showing you how to kind of place it. And it tucks in underneath your mask. And you wear the filtration system either around your neck, or you can clip it behind, or you can clip it on your lab coat in front and, you know, have it available. It automatically has filters in it that you will replace, but it will give you more fresh air volume behind your mask. People that do wear these say they've been a lifesaver. They were going home with headaches, kind of dizziness. They noticed their oxygen level was decreased. They went in and used one of the pulsometers and noticed that their own oxygen level was really low after a day behind their N95 mask. So if you're noticing headaches, or you just notice that you're really tired at the end of the day, just fatigued, your oxygen volume is down. So this is a product that you may want to consider. And these are some resources for you. They're available on my website under the article tab. You can look at the different products that you should be considering. This is a new long-term prevention of peri-implant complications, maintenance, and home care put out by the Straumann Group that has SIMs on there showing why we use the instruments that we are using. And then home care for all different types of implants. You can download that as well. And there's information on my textbook on the website as well. So sign up for the Dynamic Concept blog on my website. Send me questions or concerns that I can answer back on the blog as well. So I just want to thank you for joining me today and answer any questions that you might have. I'll just pull them up here. Okay. And a couple of these are insurance questions, you know, insurance and CD questions. I technically, you know, not allowed to answer coding. You have to be certified in that now, but I would check with Codeology.com, which is Patty DeGangi, or other sources like that to check and see what codes for that are available. And then what about a patient in my dental practice who stopped using floss and only started using Waterpik for a few months, and then they had a change in diet, but always follow up with a floss, never just water floss? Okay. Well, is hydrogen peroxide rinse helpful before a dental visit for your protection? Yes, hydrogen peroxide rinses have been shown to be a good pre-rinse selection. True hydrogen peroxide doesn't taste very good, so I would recommend getting a product like the Gum Care by Oral-B that's available retail-wise and from your distributors, or Clinical Formula. They both have hydrogen peroxide in them, but they have a flavor that the patients will tolerate just a little bit better, and to make sure that they're doing that before they come. Or you can also get them started on doing things like using Closys as well. And the electric toothbrush, Well, right now, I would highly recommend, if you can, the new IO technology by Oral-B, because it is so smooth and effective. It does actually feel like you've just had your teeth polished, and it removes the biofilm really well. And it also has a really nice massage setting that's going to stimulate the tissue. But any of the electric toothbrushes that have a massage setting, they don't have to be the fanciest one on the market. Just have your patients look for one that has a massage setting, or maybe you can talk to an Oral-B representative or a Colgate or someone representative that you can stock a typical electric toothbrush that you really like in your office. You can stock it and recommend it, talk it over as a group, have the different companies in with a lunch and learn and decide which one that you would like to use. But there is a significant difference in the IO technology over sonic technology. So I would look at that if you can. I'm just seeing if there's any other questions. Can we dilute the hydrogen with water? I think you can. If you're using it as a true pre-rinse, you would want the whole concentrated amount of it. But like I said, you could get it in different companies. Colgate also makes one, and Oral-B makes one. And those have a little bit better flavor for the patient, and you won't need to mix them with water. Would you not recommend Listerine? And one of the reasons why I didn't mention Listerine is because of the research and the chlorine products, the chlorine dioxide or the CPC rinses are lasting for 8 to 12 hours. And that was one of our criteria, one of our highest criteria that we wanted on a regular basis. But the Listerine with no alcohol certainly can be used and should be. If the patient is really likes it, that's wonderful. A lot of patients like the Listerine with the alcohol because they like that pow, but really is not necessary for the patient. I think that's about, there's one more, is who makes silica paste. The silica paste you can get, Ivoclar Vivident makes a really good one with their fine. Next by Preventec, their fine is actually diatomaceous earth, and it comes in all the flavors. And Directa makes Pro, which is a coarse silica to a fine silica. So I just want to thank you all for coming tonight. And I really want to thank GC America for making this possible. And I hope you all have a good evening. Thank you.